Hi, Dr. Hizon, here to talk about the ankle and ankle injuries and how to document ankle evaluations period. As a disclaimer, please refer to your particular doctor on the details of what he or she would like documented. This is a general course not intended to be medical treatment, and your particular situation may vary. So symptoms are very common to have ankle injuries, probably the most common thing we see in primary care as well as in sports medicine. It can be caused by a sudden injury or cumulatively. The pain can be with weight-bearing activities or with just regular exercise, but also could be from trauma. And patients may complain that they hear popping or grinding. The physical exam, we look at parts of the range of motion, flexion and extension, may have positive provocative tests, and these go by the name of the Taylor tilt test, eversion stress test, anterior drawer test, as well as the squeeze test. And there are Ottawa guidelines for when you should be getting x-rays, and we can go through those. And on the testing, it usually starts with the history of what the patient complains of, the physical exam. Then you can do x-rays, you can do musculoskeletal ultrasound, as well as even advanced things such as MRI. And for the treatment, the usual thing is to avoid aggravating activities, possibly anti-inflammatory medicines like Motrin or Aleve or Advil, home exercise or formal physical therapy with a physical therapist. And then you can use ice, and typically the thoughts are to use ice for only up to 15 minutes at a time, and you could do that several times a day. And after that, more advanced things can be injections such as cortisone or even platelet-rich plasma, which are some biologicals. There are other things that can be injected. Surgery, which is rare, can be arthroscopic, where you removal of irritated debris, cartilage, bone spurs. But also, you can do open procedures that are used to stabilize, especially with fractures. And with patient education, we teach them not to avoid activities that irritate, the ice and elevation treatment like we've talked about, as well as some stretching exercises, especially of the calf, and then strengthening exercises to give you both static and dynamic balance type exercises to decrease your risk of re-injury. So how do you document this? So it always starts with the chief complaint, and typically the first statement might be pain in the, and then you have to say which ankle, left or right. Be very careful about laterality, like which side it is, left or right. And remember, it's the patient's left or right. And then how many days or weeks or months has the pain been going on for? And the history of the present illness might start with a such and, like the name is a how many year old male or female with a history of say right ankle pain, presents today for pain in the right ankle for how many days. So in this first one here, this would actually be with a history of, say, diabetes or whatever medical problem, and then this would be the ankle. When did it start? The context, as was it sudden or gradual? The location, is it on the front of the ankle or the side of the ankle, the outside, the inside? And then severity on pain. Out of 10, with 10 being the worst pain in your life, is it what number out of 10? 10 out of 10 would be the worst pain in their life. And what is it at rest, and what is it with activities? And then is it constant or intermittent in terms of time and duration? Is it sharp, dull, or achy? And what makes it worse, but also what makes it better? Are there other symptoms, like is it worse at night? Is there any tingling or numbness? Is there popping, clicking? Have they had a previous injury? Have they had surgery to that affected joint? How have they treated it so far? Have they used rest, injections, meds, physical therapy? Have they seen other providers? And then previous workup in terms of imaging, x-rays, MRI, ultrasound, and what specialists have they seen? What other treatments have they done? And then with the past medical family social history and review of systems, I like to know, are they a smoker, tobacco-wise? And then are they on any exercise program? Are they training for anything? Are they on a special nutrition program? How is their sleep? And then review of systems, especially constitutional symptoms. Have they gained or lost weight since the last visit? And on the objective template and exam, you usually describe generally an alert, male or female, and what kind of distress are they in, You may look at document their skin. On the ankle, is there tenderness to palpation to the lateral malleolus or the medial malleolus or anterior or posterior? And you have to also understand that there's the ankle and then there's the foot, and they have separate examinations. With the ankle, you want to look at flexion and extension, and also on the foot, is it the forefoot, the midfoot, or the hindfoot? And then how about the other side, the unaffected ankle and foot? Are those a problem? And then the typical exam for the affected ankle might be limited range of motion with pain, positive anterior drawer, positive external rotation with stress test, positive squeeze test, positive crepitation with ranging, tenderness to the distal aspect of the fibula, tenderness to palpation of the lateral malleolus, positive hypertrophy of the gastrocnemius. So many of these are the things that might be documented, and your provider will tell you about these. And then on the assessment of the medical decision making, you have to decide, is this a simple or complicated case? Does it require straightforward or complex decision making? And then what are your treatment options? And usually this is where the provider and physician will discuss reasons for the treatment and rationale for the treatment. On the diagnosis with the ICD-10, remember with orthopedic type things, a lot of times they are M codes, but they can be S codes. M code being just pain in the right ankle and joints, and this would be for the left ankle. And then sprain of other ligaments on the right ankle, initial encounter versus subsequent encounter. And then with these orthopedic injuries, you always have to put a Y code for the activity that they were doing, say with basketball, and also the place of occurrence. So besides the diagnosis, and it could be a symptom type diagnosis, and then the actual specific diagnosis, you want to know the activity and the place of occurrence for the billing. And then a typical plan or treatment would be a home exercise program, but you could have formal physical therapy and inflammatory medications. You can have different imaging modalities, x-ray, musculoskeletal ultrasound, as well as ankle injections and or surgery. So in terms of pearls and pitfalls, the most important thing for me is to try to get the correct affected side, left versus right. Remember, it's the patient's left or right. Be sure to document all previous treatments, especially surgeries, and have they had previous like sprains and strains. Learn the various physical exam tests such as the Taylor tilt test, eversion stress test, anterior drawer squeeze test, and then please ask your doctor or provider if you have questions about the examination that they find on their x-ray on their ankle. And then in primary care, always ask about quality measures, which are preventative type measures such as colonoscopies and mammograms. So takeaway points: injuries to the ankle are very common. Usually there is a traumatic mechanism, meaning there is usually a specific event, but it can be chronic. Study hard to learn the various ankle tests that are commonly used as shortcuts, such as the Taylor tilt, eversion test, ankle anterior drawer test, as well as the squeeze test. And again, we appreciate all that you do, because while doctors save lives, you medical informatics scribes save doctors. Thank you.